Welcome. Welcome to Pilates Applications for Health Conditions. This is a discussion in advance of the publication of the book, Pilates Applications for Health Conditions, Case Reports and Perspectives, edited by Madeline Black and Elizabeth Larkham. It's Wednesday, February 17th. We're celebrating Heart Month. And our guest today, the contributing author guest, is Joe Strutt. Joe is a Pilates and Garuda rehabilitation practitioner and pranic healing therapist. Before Madeline introduces Joe, let's take a look at how things will work. The chat is on, so please do say hello and tell us where you're joining from. We welcome your questions. Please submit your questions using the Q&A button on your screen rather than the chat, and Joe will answer as many questions as we have time for. The webinar will comprise roughly 45 minutes of mixed discussion and practice, followed by 15 minutes of Q&A. And although we're due to finish on the hour, we may go over a bit as Joe has time before her next client, her next clinic event. So if there are lots of questions, she's happy to stay. For your movement practice, please make sure you have some room in your area and also bring your props. We'll need a foam roller, a squishy over ball, a gym ball or physio ball, and a chair. The webinar is being recorded and Handspring Publishing will share a link to it in the follow-up email. The webinar is also streaming live on YouTube. We remind you that this discussion is for informational and illustrative purposes only and is not meant to impart medical or therapeutic advice. Over to Madeline now, and Madeline will introduce Joe.
Well, welcome, Joe. We're honored to have you here with us and sharing your incredible case report that's going to appear in our book. Very exciting. But let me tell you a little bit about Joe. She's a clinic owner and director of the Brigham Clinic in Crawley, United Kingdom. And she's a Pilates and Garuda rehabilitation practitioner and a pranic healing therapist. Joe has worked in the field of movement rehabilitation for more than 20 years. Her treatment program, Broken to Brilliant and Beyond, facilitates the journey from pain and limitation to optimizing physiological health. Her own life took her down a path of early success, dancing and singing on London's West End stage, and then to tragedy when an accident while performing in the Fosse, the musical, left her with career and life-changing injuries. This was the beginning of her search for embodied truth in the process of rehabilitation. Joe's experience is authentic and personal in the world of physical rehabilitation, integrating Pilates and osteopathy in the award-winning multidisciplinary practice at the Brigham Clinic, run alongside her husband, Trevor. He's a fourth-generation classically trained osteopath. Joe has worked with elite athletes, Olympic athletes, a world champion boxer, a world paraclimbing champion, to the moms and babes recovering from traumatic birthing processes, professional dancers, clients recovering and healing from accidents and injuries, both pre and post-surgery, to the 83-year-olds who are determined to get on and off the floor to perform their Brigham back and body care exercises, post-knee and hip replacements. She also hosts educational workshops at Pilates and osteopathic conferences and mentors practitioners in the holistic health field. Joe has been qualified in rehabilitation Pilates since 1998 and continues to evolve new ideologies from international experts, bringing groundbreaking research and modern understanding of the body to her practice. In her partnership with Trevor, the Brigham Clinic's team of 30 practitioners have been recognized as highly recommended in the Institute of Osteopathy's recent Outstanding Care During COVID Award. And she continues to offer her clients excellence through Pilates, Garuda, and pranic healing alongside many other disciplines with the Brigham Clinic. And on a personal note, Joe and I met in 2019 when we both were presenting at a conference in London, and it was called FAB, Fascia, Articulation, and Bones. And it was hosted by James De Silva and myself. And she and I, when the conference was over, we were sitting down in the hotel bar having a glass of wine together. And she says to me, can I talk to you a bit? I have this new client I'm going to start working with very soon. And here is her condition. And Elizabeth and I had already started to work on gathering our contributing authors at this point. And when I heard this case report, I said to her, whoa, okay, can you wait just a little bit? And like, can we like use this as a case report? And she was like, oh my. So that's how we got connected, is where we met and how this case report and client came about. So it's wonderful to see the outcome. So Joe, why don't you tell us about your client?
Thank you very much for that introduction, Madeline. So I've renamed my client Venus, the goddess of love, just for ease of who I'm referring to. And she has a condition called arrhythmogenic right ventricular cardiomyopathy, or dysplasia. So the capitals ARVC or ARVD, I believe in America, is what this condition is known as. And she's had an implant of a cardio defibrillator, cardiac arrest, get the trolley shock thing, inserted underneath the collarbone, which is actually slipped underneath her armpit now. And she's had 2 surgeries, one that was from underneath her breastbone, addressing the outer edge of her heart, and another surgery that's gone up the veins of the legs into the inside of her heart. There's more to come through the case study that we'll share shortly in a moment, but bear that in mind. And to start with, we're going to move first. We're going to be moving with what the case study has in mind. And this case study is relative to gait patterning. So I'm just going to pick up the pelvis here, and I'm just going to bring this patterning to your attention. We can call it a helical type pattern, where we see the pelvis bones and the triangular sacral bone in the middle there. There's this helical pattern in walking. Equally, slightly higher up into the rib cage area, there's also another helical pattern that happens in walking. And so I'm bringing that to your attention, along with the arm swing, because I'd like you to all jump up out of your chairs and have a little walk around, because I need you to tap in and check into what your walking is like. And we'll then come back to our chair. So you don't need any of your equipment just yet, just your chair, but up you jump. And you'll lose my head now, so please excuse me, I'm going. And you're going to be walking around, and you're going to, as you walk, notice, what does your arm swing do? What does your foot patterning do? What does your leg tracking do when you take your little stroll around your room? And then you're going to come back down to sitting on your chair. And when you come back to sitting on your chair, I'm on a little stool here, but if you're on a proper dining room chair or something, you want to perch quite close to the front edge of your stool. You're going to check that your feet are flat on the floor and parallel, in line with your thigh bones, in line with your pelvis. And I'm just going to check that you're stacked up on top of your sit bones. As you push your hands into your knees, we're just going to lean back into the back of the rib cage and do what I call a scoopy forward bottom pelvis. And then you're going to pull your hands onto your knees and rock into an arch position, sticky outy bottom pelvis. So we're just going to rock between the two, because I need to be sure that when you finish that last arch, you then come back to sitting atop your sit bones. And from here, we're going to look next at what happens when you twist through the rib cage allowing your hand to glide up your leg to your hip bone. And what does your helical pattern, your rotation, feel like through your rib cage? Do you have a preferred side? Are you able to go further in one direction than the other? Just notice what you're doing. Are you what I call a knee walker? Are you actually moving your thigh bones? Or are you able to keep that pattern to your rib cage, a bit like a jam jar lid, being able to unscrew the lid of the jam jar as you look from side to side? So that's just recognizing that range in your rib cage. Now, please bring one hand to your breastbone and one hand to your belly. We know that the heart is deep inside, just underneath the breastbone here. Our organs are underneath the belly hand here, and our heart sits on top of the diaphragm. When you breathe in and breathe out, we're just going to notice in your body what your heart is doing. As you breathe in, your heart would be sinking down on top of your diaphragm. And as you exhale, your heart would be floating back up on that diaphragm. Have one more breath in. And then breath out. Just noticing how your heart sails up and down on your diaphragm. Brilliant. And then bringing your hands to the sides of your rib cage. Let's inhale here and notice how much side expansion you get. How much do the lungs inflate in the front or the back of your body? What do you notice at the beginning of the session? Inhaling and then exhaling. And the role of the heart is to transport the blood around the body. We know that much. And the blood is going to go from the heart. It's going to go to the lungs, where we're going to get the oxygenation process from the breath in. It comes back to the heart. And then the blood goes all the way out to the very ends and tips of your fingers and tips of your toes before it then comes back. So you might join me in this pattern of movement. So as I breathe in, I expand my lungs. As I breathe out, I just observe the heart. Maybe a little sinking action. When I breathe in, I reach all the way out to the fingertips, to the toes, and then breathing out, everything comes back to the heart again. So it's just giving you an idea of how that might be embodied. Brilliant. When you place both hands on your heart now, are you aware of your heartbeat? Can you feel it a little bit more? Sometimes we don't even notice it. It's just randomly happening. But notice what that feels like just now. We're going to go to slide 1 now, please, Hilary, and we're just going to talk a little bit more about the anatomy and the function of the heart. I recently attended Gil Headley and Joe Averson, Michael Shea, their fantastic fascial hub session about the heart. And as you'll see on my slide here, the heart starts as a tube and in utero. And if this is my tube, it spirals and spins into the shape that we're more used to seeing with the aorta and the pulmonary vein coming out of the top there. And so that spinning action, we're going to hold that thought too, because in utero, from week 5, the heart starts beating and it's fully developed by week 10. So thanks for being able to grow with me to being this side. When I was in my mom's tum, it started at that week 5 to week 10. Fascinating. So the heart beats by itself. It's moderated by the vagus nerve, the 10th cranial nerve, and the accelerator nerves of the thoracic level 4 and 5 will have an impact. The attachments of the heart are going to be, you may wish to feel where your inside of your collarbone is here, your breastbone. There's linings, there's layers of fascia that the heart, as if it was in its own sac that sits on top of the diaphragm, as we mentioned already, right between the lungs either side. And ideally, with the fascia that is around that area of the body, we want to have this glide. We need to have surfaces that glide. So consider that when working with clients perhaps who have had some heart surgery. Well, what is their fascial glide like, we wonder. The helical heart, it spins the blood out to the lungs for the gaseous exchange to take place, as we've just done in our little movement practice. Our solar plexus area, this area is our emotional center, and it can have an effect on our emotional heart center, of course. So yeah, we can feel brokenhearted, or we can feel heartfelt warmth or joy. There's lots of emotions that go around in that heart area. Brilliant. So that was our visual of the heart spinning with my band. So how about you now in your seated posture, just for 2 seconds, thinking of the heart in this spinning pattern, a little bit like a pepper grinder or salt grinder here, this action. I'd like you to just feel that if your heart was able to be involved in that spin as well, just experiment with now imagining you're moving from that heart spinning shape. So brilliant. We're going to go next, please, on to visiting my case study, my Venus. We've renamed her that, haven't we? So let's go and see the next slide, please, Hilary. And it's the first slide, which is the first day I met her. And one of the test exercises, if you will, and assessments that we did was walking towards the camera and walking back from the camera so that we could observe. Notice I've placed 2 stickies on her ASISs, on her hip bones here, and we're looking at that level. We're seeing her walking towards us. I'm noticing her foot plant and what's happening with the mobility through her feet. I'm noticing her leg tracking, where the thigh bones are going, how the pelvis, that helical pattern is or isn't happening, and what her arms are doing. You know, we've just talked about that rotation through the rib cage. How much do you see she has here? How much arm swing do you see? And her head position as she's walking towards us and away from us. So a little bit more about what she's experiencing as she's doing this, which is that she reports that she has constant right lateral side hip pain, trochanteric bursitis, that she scores herself with 8 to 10 out of 10 on most days on her right side more than the left. She has constant lower back pain, scored her own score of 8 out of 10, along with left-sided upper neck pain, that she gets headaches. That's been present since her last surgery with the general anaesthetic. She feels perpetually twisted, weak in her core and pelvic floor. She feels like she's missing out on all of the lovely hard cardiovascular workouts that she used to do, but she's very fearful to work out post her heart operations. We've talked about the ICD that slipped under her left armpit, and she has quite a bit of discomfort, is not able to sleep so easily. And bless for her, she's not so keen on her, what she named her hunchback of Notre Dame, forward head flexed position. Her GP was requesting that she have a bone DEXA scan, and so at this time, back in January 2020, she was still waiting for her DEXA scan. So this was how she looked on that first time of assessing. On the next slide, you'll see that continuing on the left-hand side of your slide, but on the right-hand side, this is what she then looked like on the 12th of February after having 10 one-to-ones and also doing her home exercise 3 times a week. So we can see already that her foot patterning has changed. She's definitely able to get more mobility through the foot as it's planting on the floor. You can see how her legs are behaving slightly differently. Her pelvis has a little bit more helical play to it, as does her rib cage. If you observe her arm swing, she's really beginning to get a little bit more freedom of movement in the arm as she's coming back to us there and then going away. Her stride, look, she's almost quicker at traveling the distance and is more confident almost in her pace. You can really see how that's starting to come together. which is great. In Holland, the research that they've been doing, they've found that there is an association between gait speed and mortality, suggesting that gait is an overall marker for health, and that the quicker you walk, the more likely you are to stay alive for longer, and that you're in a healthier state. Okay, so on the next slide, we get to hear a little bit more about her history. Oh, sorry, I beg your pardon. You're right, Hilary, thank you. We're going to look at her from the side. So even here on the 12th of February, the right-hand side, look at her more upright posture, starting position, as we see her side posture. And we've got the arm swing there. And again, traveling across the movement studio floor, seeing her working through the feet a little bit more and getting that final walk across. Much more confident. More space between the bottom of her bra top and her waist, so she really gained height in that lumbar spine and into her thorax area. Brilliant. So the next slide is just going to be looking at a little bit more about her history and what she does as movement patterns. So she's 53 years old and she works as a non-surgical facialist. So she does facials where she's holding two implements and rolling them up and down her clients' cheekbones and under their throats, forehead, and what have you. So she sits forward flexed and rotated over her patient with her arms doing constant moving. She walks her dog twice a day. She enjoys her movement. She was diagnosed when she was 40. She was in the gym on her treadmill and recognized that her heart rate was hitting 200 beats per minute. And then she was having some syncope, she was having some blackouts. So she got some cardiology appointments. So once she had been diagnosed with this, she was kind of looking at, well, what does it really mean and what do the symptoms bring about? It's about irregular heart rhythms. There's changes to the outside tissues of the heart itself. It's as if the brick walls are crumbling, the outside tissue of the heart muscle itself, and it can cause ventricular tachycardia, heart attacks, and sudden death. It's very much more common in a younger person as well, and increased cardiovascular activity can actually make it more reactive. So monitoring exercise and having the ICD is a really safe way for her to know that her heart condition will be managed. And the next slide, please. Hilary, that's it. So in the April 2019 and the May, she had her surgeries, and then into the August. So she had some ablation surgeries, as I mentioned earlier, one that was going underneath the breastbone to deal with the outside of the heart, and one that was going up through the veins of the legs to deal with the inside of the heart. And the ICD, as we say, it was originally set to be slightly under the collarbone, but then has slipped underneath. So what she reports now is if she brings her arms up too high, that then she feels her heart rate change. So I was having to be mindful of that in exercise selections. She's been diagnosed celiac. She's perimenopausal, menopausal, not quite sure, because she has a Mirena coil, but she was noticing that she has flushes, feels the heat, some mood swings, and palpitations as well, as it's, you know, a menopausal symptom pattern. So yeah, quite a lot to be thinking about in terms of organising her pattern, but wanting to keep it relevant to Gait. What we thought we'd do today is share with you some of her home exercise program, because I can't be in the machine studio. So if you would like to run around now and find your roller and your overball, then that would be great. You won't need your chair. This is what I mean by one of those overballs, one of these squishy ones. So we'll use that second. And first things first, you're going to place your roller onto the floor, and we're going to, you can all see me, I think, can't you? Yes. You're going to have the roller underneath what I call the bra strap area, the back of the diaphragm effectively, and your feet can be planted on the floor in line with your hip bones, they're parallel, and you're going to bring your fingers interlinked and have your hands clasping behind the back of your head with your thumbs supporting your neck. I can still see my elbows outside the corner of my eyes. When I breathe in, I'm going to lay back over the roller, and when I breathe out, I'm going to come forwards. So if we imagine being Venus, and we know she has a little bit of a thoracic curve there, image in your movement what that might feel like. How much range might she have, or might somebody have if they've had some cardiac surgery? This could be really, really stiff and not have the range that I have in my demonstration here, perhaps. And so we can move from the rib cage perspective, or we can move from the organs. So now as you inhale, imagine the top of your lungs laying over the roller, and on the way back, sink your lower lungs to be able to bring yourself forwards. And then the top of the lungs will lay back. And then as you exhale, the lower lungs will bring you back forwards. Staying here, we'll then add in a foot action. So in our walking gait positioning, we want to be able to feel the ball of the heel, the outside edge of the foot, the front ball of the foot, the 5, 4, 3, 2, 1 toes landing down before we then lift the heels up. So just pattern that dorsiflexion, plantar flexion action in for a second. Now leave them flat. The next time when you breathe in, you're going to lay back over the roller. On the next out breath, float your pelvis up in the air, reaching your knees over the toes, and let your head be heavy back into your hands like it has the weight of a bowling ball. Now give me the foot action as you go through your dorsiflexion, plantar flexion, rolling through the feet. You can feel yourself massage the roller up and down your back. So I was using this as a way of connecting the foot patterning and the massaging through the upper back, forwards and backwards, and then landing both feet down, landing your bottom to the floor, and then just bringing yourself back up to a seated pattern. You might notice here, when you breathe in and out, you start to expand more into the back section of the lungs. We know 70% of the lung is in the back of the body there. So we want to make sure we can open that. Now, I'm bringing the roller to the side where I can lay the left side of my body onto the roller. Now, some of you may be a little bit tender / bony / uncomfortable. So if you need a pillow, don't be shy, lay on a pillow. But in principle, you're going to have your knees and feet together. You're going to lay your side rib cage on top of the roller. And I'm now looking at moving the thoracic cage in a side bending action. So as I pull the roller towards my pelvis, I bend over to my left. As I reach the underneath elbow away, I'm bending towards my right. And the mission, should you choose to accept, is can you move the roller and not lift your bottom off the floor? So I'm getting that rolling, massaging out, opening the top ribs and lungs, and finding this pattern as we go from one side to the other. Land the left hand on the floor, straighten your top arm and your top leg away from each other. Here we have this fascial stretch that now means I can connect the whole outside line of the leg, the foot, the side of the waist, out through to the very fingertips. If you wish, you can pull your arm out a little bit more, and then bring your hands back behind your head. Let's bring the helical pattern of the rib cage into play now. So as I come forward, sorry if I'm squashing your boobs, as you come forwards, breathing in, and then breathing out to roll back, I want your focus to be on the underside rib cage, so that you're rolling to the side ribs, to the back ribs. Don't forget my spinning image of the salt or pepper grinder of the ribs, the lungs, top lung coming back and around the heart, as you come forwards and come back to the center. Bring your fingertips to your shoulder pad and we'll do a bent elbow chalk circle so that we can bring the elbow to the floor in front of you, reach it out overhead, opening back behind you. So I'm really seeing now, if I can let gravity help me, the rotation opening through the chest, of course for her ICD underneath, I'm not leaning into that, and I'm able to move this arm into a full arm pattern. So you can extend and reach the arm so we get that full reach from fingertips all the way out and down through to the feet. And then last circle, coming all the way back around. So we'll then whiz over to the other side. Oh, instantly, have another breath in. Can you notice, is one side of the lung giving you more expansion than the other side? So we'll pitch over to this side. Do grab your squishy, because after we've done this side, you'll want it nearby. You don't have to be jackknifing up and down and having to find that. So when you lay on this side, check that your knees and feet are in line with the pelvis. You're going to bring your hands behind the back of your head and just noticing the top of the lung being able to lay over the roller as the left upper lungs lift to the ceiling, and then reaching the underneath elbow out and away. So if you're in your embodied heart position here, how does that feel for your heart between your lungs as you're lifting and then lowering, reaching out the way, finishing with that arm on the floor for a stretch of the top arm and the top leg, really feeling the connection from fingertips down through to the foot, inhaling and exhaling, maybe just pulling the arm out a little bit more. And then bringing both hands back behind the head. We'll do that rolling forwards as you rotate, feeling how the underneath rib cage is being rolled on. It reminds me of a roller in a paint tray. You need to roll the roller all the way backwards to fill it with paint, and then all the way forwards to fill it with paint. Keeping the back of your head into your hands. Back to that start position now where you move your fingertips to the shoulder pad for the chalk circling, reaching forwards, up and over. And of course, the range is going to vary according to the architecture of the person in front of you and their history. So it may be that it starts small and then we get bigger, and we can then change that bent elbow chalk circle to a full arm, reaching all the way out of the space, opening the chest, all the way forwards again last time, and around, and then back to the start position. We'll remove the roller, and then we'll bring yourself coming to laying on your back with your squishy ball, so that your squishy ball is going to go directly under your skull. And we talked about the inside collarbones of where the heart hangs from the throat, the inside collarbones, and sits between the lungs. Now, with your arms by your side, as your chin lifts, do you get a sense as it lowers and lifts what's happening to that heart? Does it move? Can you feel a connection with yours? And what we might find is in a very fixed thorax that all of the movement happens right up at the top of the neck. And we know that we want to be able to share the movement evenly through the whole spine as we're lifting and lowering. Come back to the center. Let's look at the rotation from side to side. We mentioned that her neck, she had neck pain and headaches since the anesthetic, where I think the intubation, she felt that it was very different after that. And as she was turning with her head on the ball, she was then able, when we added a bounce, so we bounce along as we turn our head to the side, she was then able to use this exercise as a release for when those headaches and or that neck discomfort was coming in for her. And you can get a sense of how your heart can just not bounce along, but it does feel like you can have a sense that it's attached to the throat and the head and the neck positioning as you bounce from one side all the way back into the other. So that's the first half of some selections of her home exercise program. Come to standing, have another walk around before you sit back onto your stool. And let's just notice when you're going through your walking pattern now, do you have any change for your body having done those movements? And when we come back to sitting, look a little disheveled. Let's get that sorted. So we come back to sitting now, and on your chair when you sit back down, how about you go back to where the hand is sliding up towards the hip? How does your rotation feel through your thorax now? When your arms hang by your side, if you just initiate from moving one lung back and then the other one forwards, does this feel any easier, any different? Question mark. I'd love to know whether that feels any different. Okay, so that was our next little movement session. So let's have a look at the next slide, please, because I believe we're going to look at what I did in the machine studio. So I used the trapeze table or the Cadillac, reformer, the chair, and the ladder barrel. I'm relative to gait patterning, so I'm wanting that cross pattern, which the opening of the hips, because we know we want to activate the back line for her to open up her stride. So the reformer, the scooter, the step down on the chair, the jump board, the leg tracking, really, really useful for the lower extremity. With the upper body, we were doing the scapular mobilization, looking at finding that rotation for her, integrating it in with the arms, working with the range that she could go to from her armpit and the ICD. We did challenge, we went into some magician, some long spring crossover. Incidentally, on I think it was week 3, we did the soleus deceleration on the chair, and she reported that she felt absolutely exhausted. So one of the self-reporting questions that we had to record was, did it improve her vitality? And the answer to that one was no. Question mark, is it the venous return, calf pump action? I don't know. I was wondering. So those were my machine exercise selections. Excuse them written in my language and not in formal speak as such. Then the next slide is sharing some of the home exercise patternings that we put into practice. We wanted to address the pelvis and the spine alignment with the leg tracking, so we made sure she was in a good neutral position. We worked on stabilizing that connection with breath, involving the extension for her thorax, keeping in mind there's a bone DEXA scan coming around, so I didn't want to treat and go into too much flexion. She does enough of that in her job. We mobilized it with those chalk circle type exercises, looking at the rib motility of the lungs, and then restabilizing, getting into some weight bearing through the tricep press ups, either on a wall or on the barrel, going up and down the stairs on hands and feet, and hip hinges on the wall, trying to really get that core connection and elongation through the spine. So there is our home exercises, which we've got to jump up again and do some more movement, which this time you're going to bring your gym ball if you've got your gym ball. If you don't have a gym ball, you can do this on a foam roller, and you will need your foam roller. So it's definitely the gym ball to start with. Let's have a look here. And we're going to do a leg press action. It's as if you were on the reformer, because I'm looking at the leg tracking, the gait analysis. So if I was on the reformer, I'd have my spine and my head support on the carriage.
and the headrest, and then I'd have my feet on the foot bar. So I'm using the ball as her home exercise. And once she's established a good pelvis position and spine position on the floor here with her arms down by the side of her body with her palms up, we're just going to get the feet and legs in parallel, hip width apart. And we're going to pull the ball in and then push the ball away. And in terms of ideal leg tracking, we observed in her video, she was what I call a bit of a knock-kneed Nancy, a bit of a valgus. Her knees were wanting to come towards each other. And so we're using this to go, where is my parallel? And then coming back in the way. We then changed to a ballet legs position, first position. My heels press down to engage the hamstring and the back line as you exhale and push the legs away and inhale to come in. So we were working on that disassociation at the hip joint with a nice neutral spine, finding her breath pattern as she pushes and pulls the ball towards her and then away from her. From there, we then did go into a internally rotated femur, not just adduction, but real internal rotation from the femurs to be able to then push away and come back in. And I'm really wanting to scramble the nervous system to go, where is my hip joint? Where should it live? It's this mixed kind of perception of where normal is. I want to get her into an optimal positioning. And then returning to parallel as we pull the ball in and then push away. From here, we then progressed into pelvic press combinations and into a Garuda bridge. So from here, with slightly slack knees, she pressed her feet down into the ball, and at the same time as pulling the ball in, peeled the pelvis and the spine up into the air, and then peeled the spine down as she pushed the ball away. So we can exhale to come up, and then we can inhale to go back down and observe what's the articulation like in the spine, how the back of the legs are working as we pull the ball in and peel up and stay up. We can keep the pelvis in the air and press both legs away and bring them back in and repeat a couple of those. And once that's feeling clear, and with the pelvis being steady, we float one leg up in the air and we push the ball and pull the ball, making sure that the spirit level across the front of the pelvis, let's change legs, that the spirit level across the front of the pelvis is not dropping. And we saw her favored side. This was a challenge for her. And then she rectified both feet on and then coming back down. So that was a leg tracking little home exercise program for her there. Let's whiz the ball away. Once that's out of the way, we're going to lay down onto our tummies and bring the foam roller to your head end of your mat. And we won't start with the roller. We're just going to do what I did was a little breath patterning for her. So one hand on top of the other, forehead resting onto the hands. Image where your lungs are and your heart. Is your heart in the back of your body? So she would have been here. Incidentally, her first time she laid down on the floor, she couldn't get both of her ASAS hip bones on the floor because her right one was off the floor when she first laid down. So it took us a couple of weeks to be able to get both sides of the pelvis connecting to the floor. So we inhale, ribs expand, exhale, let your heart fall forwards into the front of the breastbone. Repeat the breath again, please. And breathing out. Now leave your heart sinking into the mat as you lift your head, your brain off of the mat. Feel your lower lungs are in the mat as you inhale. As you exhale, your heart can move further forwards as you lower back down the way. So we started with this breath in, shrugging the shoulder blades up, breath out, sliding the shoulder blades down, dropping the heart forwards into the mat, to then float on up. This soon progressed to moving, windscreen wipering the arms open into a sphinx posture here almost, and then being able to bring the roller into play for a roller with the swan. Now we progressed to this, of course, because of the arm. What she liked about this position was that she wasn't in such high shoulder flexion on that left ICD side. And her job, as I demonstrated earlier, was that she would sit and she would be flexed forwards and she would have elbows bent all the time. So we then used this as a way of connecting the elbow bend with the extended upper thorax. So where we worked with changing her breath pattern around in this exercise here, and then lowering back down. So once we found that very nice new lengthened thorax, we knew we wanted to keep it there. So one of the next transitions, we went into 4-point kneeling, but on forearms, again, because she sat with elbows flexed over her client. So we started with elbows bent, forearms flat, 10 finger pads pressing, transferred forwards with the weight, balls of the feet tucked underneath, and just challenging her to hover and then lower. And exhale to hover and lower. Her head really wanted to fall off. So we really wanted to concentrically work those upper dorsals to keep her in that neutral position. And then we progressed to another version, but adding some rotation here, where keeping that spine lengthened, she was able to find that helical rib pattern again by softening one elbow and then straightening, and then softening the other elbow and straightening. And one of the things that was tricky was that her pelvis wanted to do the action, and we needed to keep that quite steady, and that the rotation was really coming from dropping the right lung to the floor and then lifting it back up, spinning around the heart as we bend and straighten, and last side, almost listening as we rotate and coming back up the way. So before you sit back down, have another little walkabout and notice, does that make any change to your cross patterning? Again, the movement through the foot, the leg tracking through the toe, ball, heel. What do you notice with your arm swing? Is that any different? And then we can come back to sitting on your chair. Before we get too comfy, when you're sat down, just bring your arm swing, your natural arm swing. Can you initiate from, again, the grinder action of the heart, the one lung going behind, one coming forwards, and just noticing the arm swing. When you come to a still point and inhale, how's your expansion? How does the back of your lungs feel compared to the front of your lungs? And then fabulous. I'm sure you'll have plenty to report about that. So, however, you're probably going to want to know what she felt at the end of her sessions and her outcomes. So we had some set questions to ask her, and from week 5 to from session 5 to session 10, she strongly agreed that she had an increased movement strength, increased movement control, increased range of motion, and she felt like she was progressing. Whoop, whoop. We thought that was pretty good. This is the increase in energy and vitality. As I said, on week 3, we did the Pilates deceleration exercise on the chair. She felt exhausted, so she really didn't feel like she could have an increase in energy and vitality after that. Week 4, on that 4-point kneeling hover exercise, that was exhausting, almost weight bearing through the upper extremity. That felt tiring. And week 5, she had to come off of all of her heart meds because she was visiting her cardiologist to go through an exercise test. So she needed to take out all of her medication. Plus, she'd felt like maybe her medication was actually, she might not be responding well to it. Maybe she was experiencing some side effects with the headaches. So she was coming off of her meds that week and felt exhausted. And where do we go to next? Oh, yes. Thank you, Rachel, anatomy educator, for these lovely pictures. Look at this posture that we can see in these two photographs here. And the concerns that I see in this posture type for Venus with some of her conditions around her heart, along with potential osteoporosis, penia. This is just not what we're wanting to see. And that's kind of what she was feeling like in her working pattern. Scar tissue from her surgeries. We don't want to be fixed here. We want to focus on that elongation of the spine, working the back line of the body to come more upright. Thank you very much. And on the next table, it's a little bit busy, I can say, yes, but on the top left-hand corner, we've got what she complained of and what we observed on examination. And this long old list down that side were the areas that we were observing. And across the top, you'll see from session 1, her first session, to session 10, her last session. And if you look at the blue one first, she's starting her first session with an 8 out of 10 recording. Yet at the end of that first session, she's gone to a 2 out of 10 in back pain. By the time we hit session 5, she's 0 out of 10. And then at the end of session 10, she's 0 out of 10 at the beginning and at the end of her session. So a great progression there in reduction of her lower back pain. The pink hip pain, or whatever color that is, orangey pink, hip pain, 8 out of 10 down to 2 out of 10 in the first session, gradually reducing till session 5, where she comes in at 0 out of 10 again. And the same progressing through to her last session of reducing and eradicating that hip pain. So the pelvis in yellow, we see that she was presenting with her pelvis twisting towards the right side. We call that the right pelvic torsion. But she started the session facing to the right, but she ended her session level. But the next week she came back with her pelvis facing to the right before it ended up level. So we could see that the exercises were working for her. Now, at the end of session 1, if you drop down to the advices column, you'll see that first little phrase there, I ditched her working stool. What she worked out in her working posture, where she was flexed and leant over, she was sat on one of the saddle type shaped stools, and she'd worked out that that was actually bringing her into more of a twist. So she changed that. We can see she still, by session 4, she was still coming in with a mild twist in her pelvis, even though she'd got some home exercises to manage that. But on that end of week 4, I busted her for Z sitting and sleeping like a rock climber. I'll demonstrate that shortly. But once we'd established how to change her sitting on the sofa and also coming into her sleep position, she then presented level with her pelvis. In red, we can see that from session 7, she wanted to get back to seeing what it was like to go on her bike. So she got on her turbo bike, but she presented on session 8 with that pelvis not being level again. And so we addressed that it's how she was getting on and off of her bike that was perhaps contributing to that. And when she alternated which leg she would use to get on and off of her bike, she then was able to retain her pelvis as in neutral level position. The green is really about how at week 5, where she'd come off of her medication, in her neck range, she was quite restricted in her neck there. She went off to see Trevor for some osteopathy, but a vagus nerve, neck, body adjustment type treatments. She also is looking at some acupuncture there with Selena as well for hormone balancing. And we then see that after she came off the meds, her headache and her neck pain was then gone. She didn't have that. So that was a great combination of the treatment into the physical activity. So there were other things that we measured there. We looked at her heart rate at the beginning and at the end of each session. And we can see that her minimum resting heart rate had really decreased from week 7 in green at the bottom there. And that, I think, she contributes to coming off of her medication and being able to get into a more natural rhythm without having to respond to the medication. On the next slide, we just see it as a pretty little graph. The blue color is the score that she gave herself at the beginning of her session, and then the orange was what she came out with at the end. And we can see that once that pelvis stabilized, her pain was quite different. She was coming in with a neutral pelvis and much less low back pain. Yes, it fluctuated a little bit, but she was able to get rid of it by the end of the session and subsequently at home afterwards. The next slide shows a similar graph for hip pain, and we can see where her Z-sit and her sleeping like a rock climber had an impact on that again. Final graph is the neck range. So on this one, she came in with her neck. I used Coach's Eye app to record the range and degrees of rotation that she was able to have at the beginning of the session. She did her session and we remeasured. So the blue was at the beginning where she had less range. By the end in orange, she had full range from those session 7-ish onwards for her rotation right, but still quite tight, looking to the left or a little bit tighter. Okay, next slide, I believe, is my short-term goals. Did I meet them? Because I set what my goals were off of what her goals were. So she didn't want to be in so much pain. She wanted an improved working position. She wanted to improve her posture to not feel or look so slumped. She didn't want to feel twisted anymore. She wanted to feel stronger in her core, address the pelvic floor and her balance, and to gain confidence in her daily activities, along with working out. And so, boom, yes, green, we did. We ticked all of that by reducing the pain, improving the elongation and the control through her key joint areas, and coordinating her breathing. And she's got back on her bike and she's still out walking. On the long-term goals, during COVID, she then was able to go and get her DEXA scan results, and her lumbar spine had a T-score of -1.6 and femoral neck -1.2. So we know that that is ongoing to be able to look at how to manage that. They didn't do her thoracic spine, which I was a bit gutted by, but that might be something that she will review because of her working position. So with that understanding, she now can empty the dishwasher differently because she understands to not flex through and to work on her hip hinges and her buff bone style exercises. And she's transitioning through still with the menopause. She's using the acupuncture and pranic healing to help with that. And she's already working on her heart health because she's back on her bike. So even though these were hers and my long-term goals, you can see we managed to get quite a lot of green ticks on that as well. So she did really, really well. She's gone back to her doing some yoga and body balance and some weightlifting, light weights, and is enjoying that. And what would I have done differently, or what could I have done differently? I could have used a heart rate monitor, perhaps, wondering what that might have been like to look actually at the health of her heart or how her heart was running at the beginning of the session, during and or at the end. I did do some jump board work with her, and I was really mindful at that point that I might well be putting some extra stress. She didn't feel like her heart rate went up. She jumped on my heart rate monitor machine at the end, and she was experiencing a decent level and not an extraordinary level, but that would probably have given us more information about her heart. But this study was relative to Gait, so thank you for your scope of practice, for scope of focus with that, Madeline Elizabeth. And I would love to personally look at the combination now of my pranic healing work and look at how the solar plexus energy affects the heart energy, affecting the crown energy and the basic chakra, and how we can anti-clockwise direction remove negative energies, dirty energies, and then put in more positive energy in the clockwise direction, and question mark, would that make any change to how she feels? So the pranic healing crystal work and the psychotherapy protocols, I would like to look at that around stress and anxiety, around the confidence in moving. So those would be the things that I had thought of that I would do differently.
Fantastic. Thank you, Jo.
A pleasure.
Really amazing.
Thank
Yeah.
you.
Thank you so much for that comprehensive and amazingly inspiring presentation. So thorough. You integrated so many aspects of clinical excellence and therapeutic wisdom. Before we go to the questions that have accumulated in Q&A and in the chat, let's take a look so people will know how to contact you at your clinic. Hillary will take the slide, the closing slide. And this shows how you can get in touch with Joe by email and the website for the Bridgham Clinic. We'll just note that in March, we welcome Glenn Withers, who's a physiotherapist and who's the head and the founder of the Australian Physiotherapy and Pilates Institute, APPI, who will speak on Pilates applications for hip conditions. And now let's return to the questions, the Q&A for Joe. Joe, you so skillfully integrated many concepts, vocabulary from the osteopathic model, the Pilates model, the energy healing model. And to that integration comes this question from Michael Hall. When I use spiraling vortex exercises and press into my Achilles heel and create elastic recoil in my lower legs, I build up increasing amounts of kinetic energy. As a result, I'm able to sprint much faster. Is kinetic energy the same as prana?
Interesting question. Thank you, Michael. And how amazing you've really connected into the intention of the fascial kind of connection within my exercise selections. I think you've connected from the heel of your foot all the way up through your legs. And so, yes, perhaps the connection from your foot all the way up and out through that kinetic chain. Is it the same as prana? Prana, I would describe as energy that can be found from, say, energy within the air, from the earth, from trees, from the energy of our cells and our body. So perhaps, yes, that the kinetic energy is the same as that, and that you found it through that coil through the lower leg. I think that backline connection and into that spiral has really helped you there. So well done. How fast you run. It sounds amazing.
Someone asked a question, Joe, about they're curious what happened with the device. Why did it fall under her arm?
Yeah, good question. And one I have asked as well. And I don't actually know. I believe that the device is intended to sit from under the skin within the fatty layer, I suppose, the adipose layer, and that it's not any deeper necessarily than that at that point. I'm not sure why it moved, and I don't know whether it was because of where that particular surgeon was choosing to place it. Was it different to someone? I really don't know. She doesn't know either. They did suggest that they wanted to go back in to move it back to where it should go. And she was like, I've had enough of surgery right now. Thanks very much. I'm good as I am.
Joe, the next question comes from Ann Waite Gilmer. And she wonders, have you used these protocols with other heart patients with similar results?
If I have used these exercises with anybody, well, maybe they have some heart, maybe some irregularity, some atrial fibrillation, maybe they've got something that's medically managed, and I haven't thought, oh, I must do that with them because they're a heart patient. It's come as they've been doing that exercise because it's part of the motility and keeping that movement going for that area in their body. So I'm not really looking at my patients, clients as, are you a heart patient or not? I'm trying to consider their wholeness. Their heart is a part of it, and whether we have a condition there or not, it can be that it's what it needs. My thought process is around the
rotation, from my understanding, is that first movement that we lose in the delightful degenerative slope called aging. And if we are going to stiffen up, rotation is what's going to go first. So for me, I want the movement to be as optimal, to bring the body to give it the best chance to be as good as it can be. I hope that answers your question, Annie. Hello.
That's great. So Monica asks, are there contraindicated positions for heart clients?
I think the contraindications for post-ICD and ablation surgery, and certainly the ICD, is more relative to, say, the first 6 to 8 weeks post-surgery. You don't be doing too much arm traffic control type exercises. You're going to reduce that whilst you're going through that healing process. So my understanding is post-surgery, there are contraindicated timeframes where your physio and your discharge team would make sure that you know that you're not to do those movements in that time. I see emotional patients, if you like, who are having a hard time and are quite flex and quite grit, that sometimes doing too much work laying on the back without having that thoracic extension, without being able to lengthen through the spine and lie down, means that if they're a bit fixed and a bit protective over their heart, when they lay on their back, they're then over mobilizing in the neck, and they don't yet have that ability to be able to lengthen. So I'm using, I suppose, those contraindications according to what my eyes are seeing to do with their posture more than their heart.
And Wait Gilmer follows up with another question. Do the Pilates sessions ever produce an arrhythmia?
Oh, good question. I wonder how we'd find out. Yes, I suppose we could take a pulse to know whether it did or not, or whether they would have that feeling. I've never had anyone experience that. Question mark. Has she had that? I don't know.
And another question, this one coming from the chat, is how did you organize the osteopathic treatments or integrate the osteopathic treatments in conjunction with her therapeutic exercise?
I think that's the advantage of owning and running a business with my marvelous husband, Trevor Strutt, who's lead osteopath, and our combined experience of both journeying through rehabilitative, personal embodied journeys, and his knowledge and mine combining and wanting to bring them together. I was sharing with Madeline at the beginning of the session that we have this fortunate situation where a Pilates person can be in the movement studio, the machine studio, or the movement studio, and if something doesn't feel quite right for them and it's like, oh, I can't really continue because they're in such discomfort, I would say to them, could you just wait for me for 2 seconds? I'll be back in a minute. And off I disappear, and I go knock on Trevor's door and go, Trev, can I steal you, please? And then, or Ray, can I steal you? Or Dan, can I steal you? And then they'll come in, and then they'll assess what's going on musculoskeletally, where's the destructive kind of movement pattern or the obstruction from something not being quite right. And on occasion, we might integrate a treatment there and then, or we'll book that patient in for a treatment to then run alongside my treatment planning. But because we're integrated around and patient-centered, the team are used to working on the same patient, hence the same with the acupuncture, to be able to support the hormonal balancing or nutrition or foot health. So all working together around that one body. Did I answer that question?
It's heaven on earth for
It is. I was just thinking the same thing.
Absolutely. Aren't I blessed? Thank you to my amazing team for just being there with me, supporting me and all of our fabulous patients. Thank you to all my wonderful clients for letting me practice this on them. They must be so bored with doing these exercises now. They're waiting for my next mission, I'm sure, to know what's going to happen next. No, they've been very encouraging, very supportive, and I'm very grateful. And I'm especially grateful to you, Madeline, for allowing me to share that conversation, and for Venus to be able to let us do this and to see such great results. And Elizabeth, thank you so much to you as well for your wonderful comments. So thank you.
Yes.
Thank you.
Could I ask another question, since we might have 2 minutes maybe to go before each person goes to their next event? Joe, your exercises did such a masterful job of whole body connection, foot patterning to helical thorax. How do you choose, if you needed to identify a primary locus of control or a primary place where all good movement initiates for this particular client? How did you make that decision in terms of prioritizing movement?
Yeah, great question. And I think I think the osteopathic influence of the pelvis is key. And I think we see that in the progression of those graphs at the end. I don't believe that if I hadn't got that pelvis into a functioning and happy position for that lower back and for that hip, then I don't think the rest could have come into play. So I think for me, I'm looking at how the pelvis and the lower extremity behave in standing. I'm looking at how the pelvis to the head behaves in sitting. Integrate that with that breath and probably the developmental movement patterning from Linda Hartley, the integrated body movement therapy work, and which is a bit BMC, Bonnie Bainbridge Cohen type stuff. It's looking at how I then bring that patterning, because it's part of the back brain, that blueprint of what our body will know. It's bringing it in that order, I would think: pelvis, legs in pelvis, pelvis to head, and then spiral. Thank you so much. I've thoroughly enjoyed the opportunity. I really have enjoyed it, so I'm very grateful. Thank you very much.
We look forward to reading your chapter in the book.
Yeah, absolutely. I look forward to getting it finished for you all and working out next steps.
Thank you all. Thank you.
Yeah, thanks everyone for coming. I can see some lovely names and faces there. So thank you so much. Thank you, Elizabeth. Bye-bye.
Bye-bye, Joe.